The important question we have is, will oral appliance therapy work for me? As all good answers begin, it depends. We need to go over some of the therapies to find out more. So first we have CPAP. CPAP is a machine that most of you have heard of. It stands for continuous positive airway pressure, and it opens the airway by blowing air at a certain pressure that is specific for each person, and it depends on the throat anatomy, weight, and other factors. It is important to note that CPAP works 100% of the time that it's being used. Therefore, it is the gold standard for severe sleep apnea. However, the catch is about it being used. Some people cannot tolerate the machine due to various reasons, and it ends up sitting in the closet, and then it is 0% effective. CPAP also relies on electricity and needs to be cleaned once a week with brushes and soaking. Oral appliance therapy, on the other hand, is a treatment option for mild to moderate sleep apnea. Therefore, it's important to find the condition out early on so that you can manage it with other treatment options. Sleep appliance therapy works by moving the lower jaw forward and physically keeping it in a forward position all night long to allow air to bypass the collapsible airway by normal breathing action. Oral appliances do not require electricity and are favorite with backcountry campers, hunters, people who like to fish and travel a lot. With oral appliance therapy, there is some general maintenance of the appliance itself. By cleaning it, you can use appliance cleaning tablets, or you also need to do the maintenance of the teeth and the jaw position on a daily and ongoing basis. Each system of treating sleep apnea has its drawbacks, and taking care of your bite and jaw muscles with exercises and a morning repositioning jig will be important in minimizing tooth movement and jaw-related issues, and this is discussed more in another video. We also have something called positional therapy. This could be an adjunctive therapy to CPAP machines or oral appliance therapy. It is a simple theory that if you place something on your back, like a tennis ball in a sock or a backpack type contraption, it will prevent you from rolling onto your back. The problem with sleeping on your back is that gravity will pull on the chest and bring the weight that's in your body down onto your lungs, and it will cause it, making it more difficult to breathe. As well, in REM sleep, when all the muscles of the body relax, you have a decreased muscle tone in your throat, and then if you're also sleeping on your back during REM sleep, it's the most difficult situation where you can try to breathe if you're having any sleep apnea issues. Combination therapy is the combination of oral appliance therapy with the CPAP machine to allow the throat to be more open mechanically to enable a reduction in the amount of pressure that the CPAP machine has to do. So in some cases, if people are maxed out at the pressure of the CPAP machine, where do they go from there? Well, they can have an oral appliance made, and that appliance keeps the throat open, and that way the pressure of the machine can be reduced because the machine is not trying to open the airway with the force of the air pressure alone. Then we have alternating therapy. Alternating therapy is when the patient decides what device to use for which situation, whether at home or traveling. It also allows for the most dilution of any of the side effects experienced by each system because they could be alternating. So potentially at home, they have a setup with their CPAP, they like it, they're using it. And then when they're traveling, they might use a oral appliance, or they will use the CPAP machine for 3 nights and then use the oral appliance for 3 nights. So they will figure out a system that works best for them. And this definitely needs to be coordinated with the family doctors or the sleep doctor to see if this might be a beneficial setup. Then we have adjunctive tools and therapies. Definitely needs to be discussed is weight loss. Some people have sleep apnea that is dependent on the weight of the person. For every 10% of weight loss, there might be a 25% reduction in sleep apnea. However, I've had some people ask me if they lose enough weight, if their sleep apnea will go away, and likely the answer is no. However, they can reduce the severity of their sleep apnea by reducing the weight. Then we have nasal breathing tools. So we talked about nasal dilators. They come in various shapes and sizes. They go into the nose to support the nostril to prevent it from collapsing, or it can be a breathe right strip put across the bridge of the nose to help keep the nose open from the outside. Next, we have orthodontics, especially early in children, especially early on. We can diagnose with children if they have sleep apnea. We need to look at their craniofacial structure. So how wide is the maxilla, the facial structure forward and backward, and early intervention, potentially with orthodontics, can help set up the children for later on in life, again decreasing their severity of their sleep apnea. Children are rarely treated with oral appliance therapy or CPAP because of their growth that's still happening in their face. So we try to help them along as best as we can by early screening and trying to help them out with some interventions that are straightforward, such as orthodontics. Then we have myofunctional therapy. This is a newer therapy. It is basically physiotherapy for the throat and tongue. You can establish, for example, if you have mouth breathing, you can establish nose breathing by the removal of tonsils, but if there's a habitual open mouth for mouth breathing, that condition doesn't automatically having the tonsils removed does not automatically make you a nose breather. This type of situation does require some rehabilitation of the muscles of the face and the mouth to have a mouth closed and the nose breathing to happen. So this is the myofunctional therapy is an excellent way to achieve that. In summary, CPAP works great for some people. CPAP does not work for everyone. Appliance therapy works great for some people. It does not work for everyone. They say that with CPAP, it is highly effective, but there is less compliance. This means it's 100% effective when it's used, but sometimes the CPAP machine ends up in the closet. With oral appliance therapy, it is less effective. That means it's not quite 100% effective, but many people are more compliant. So at the end of the day, the two treatments might be comparable in their effectiveness. So with oral appliance therapy, you might have 70% effectiveness, but because you're using it for the entire night, the effectiveness of the oral appliance therapy comes closer to the effectiveness of the CPAP.